Hello, this is Colleen Curley, and I'm going to be doing a little video here on the sphenoid bone to help you learn the anatomy. So, let's see if we can get it all in profile here. Okay, so this is the sphenoid bone, as if you were looking down from the top of the skull, so that the projection is down. Okay, so first off, right here where my fingers are, this whole section up to here is the greater wing of the sphenoid. Okay, so you have one on either side, here and here. Okay, now there's a lesser wing of the sphenoid, and that's this smooth surface right here in the middle, right there like that. Okay, so we have a greater wing on either side, and we have a lesser wing that goes across the middle. On that lesser wing, we have two pointy little things here called the anterior clinoids, because this is the anterior surface of the sphenoid bone, and this would be posterior back here. So if we have anterior clinoids, we also have posterior clinoids. It's a little bit hard to see, so let me turn this a little bit. You see these two little things that stick out here? Those are the posterior clinoids. And those sit on the posterior part of the sella turcica, called the dorsum sela. So the sella turcica is this curved shaped thing. I'll turn it sideways so you can see it better. See, it looks kind of like a saddle in there. And when I turn it this way, what you're seeing is the sella turcica's inside, and this part that comes up the back is called the dorsum sela, which is the posterior part. And again, if I turn it sideways, this part here is the dorsum sela. Again, dorsum means posterior part. Just below the dorsum sela is this broad flat portion here, and that is called the clivus. This is the portion that must be on a lateral cervical spine when you're doing trauma. So here's the clivus. From here up is the dorsum sela, posterior clinoids. Moving forward, we have anterior clinoids. And we have the sella turcica in the middle. We have lesser wing of the sphenoid, all of this area here, and then all of this area here is greater wing of the sphenoid. Okay. Now, there are also two projections that come down, or processes that come down inferiorly from the sphenoid, which are called the pterygoid processes. Pterygoid is spelled with a P, but the P is silent. So we have both a right and a left. And there are different parts to the pterygoid process. We have I'll start with the lowest part first, the pterygoid hamulus, which is this thing that looks kind of like a hook at the bottom here. And that is connected to the medial pterygoid lamina, which would be this portion here. And I'll turn it this way so you can see it here. So this would be the medial pterygoid lamina with the hamulus at the end. It's medial because it's on the medial side. Then we have this portion right here, which is the lateral pterygoid lamina. So this is one process called the pterygoid process. On the pterygoid process, we have a lateral lamina, we have a medial lamina, and a hamulus. We have two of them. So one pterygoid process with a medial pterygoid lamina, a hamulus, and a lateral pterygoid lamina. Then we have the tiny parts of the sphenoid bone. This almost looks like two eyes right here. And I'll turn this a little bit so you can see that it's actually almost like a tunnel. And that is the optic canal. That's where the optic nerve comes through from the eye. So you have one on either side. So again, that little hole right there is called the optic canal, and you have one on either side. Okay? Then we have other things. As I tip this forward like this, you can see a very large area that's open. It is not a foramen. It is called a fissure, and that is the superior orbital fissure. And you can see that when we look at orbits, but it's in the sphenoid bone. Just below the superior orbital fissure is another little foramen, and that foramen is the Foramen Rotundum right here. There's one here, and there's one over here. Now, I'm going to tip this sphenoid bone this way a little bit. Over here on the greater wing of the sphenoid, we have two more foramen. This first one that's elongated and kind of oval is called the foramen ovale, like it's oval. And then the small circular one right beside it is the foramen spinosum. We have the same thing on the other side. The foramen ovale, it's oval, and then the foramen spinosum right here. So let's go over this anatomy again. We have the greater wing of the sphenoid, and this part actually is the part that comes up on the lateral side of the skull. And we have one of those on either side. That's the part I'm touching. Then we have the lesser wing of the sphenoid here. That broad flat surface is the lesser wing of the sphenoid. On the posterior part of the lesser wing is the anterior clinoid process. So you have two, a right and a left anterior clinoid process. Posterior to that, you have the right and the left posterior clinoid process. Those processes are in front of and behind the sella turcica. So this is the sella turcica here. This is anterior, this is posterior. Right here is the back part of the sella turcica, and the correct term for that is dorsum sela. Just below the dorsum sela is the clivus. It's a broad, flat surface right there. Then we're going to tilt this whole thing forward a little bit, and we're going to look at the pterygoid process that comes out inferiorly from the sphenoid bone. And we have the medial lamina and the hamulus, and then we have the lateral lamina, and we have one of those on either side. So here's the lateral lamina, here's the medial lamina, and the hamulus of the pterygoid process. Now if I tilt this way, this circular area here looks like a canal. You have one on either side. Right there is the optic groove for the optic nerve. And I'm going to tilt this more, and we have the superior orbital fissure, and we have one on either side. Just below that is the foramen rotundum on both sides. Now I'm going to tilt this more so we can see there is a foramen ovale, foramen spinosum, and there's one on either side. So a foramen ovale, foramen spinosum. That is the anatomy of the sphenoid bone.